Once you've decided that you'd like to go ahead and have pterygium surgery, it's really important that you understand what the whole process is going to involve, both just prior to the surgery, on the day of the surgery, and most importantly, in the days and weeks after having the surgery, so you can appropriately plan for any potential impact that the surgery itself and your recovery might have on your day-to-day life, activities, things like driving and going to work. In the lead up to pterygium surgery, there may be 1 or 2 medications you have to cease prior to having the surgery itself, and these are mostly things that cause bleeding for obvious reasons. You will undergo anaesthetic sedation as part of your surgery, so on the day of the surgery, it's important that somebody brings you into the hospital. Once you've recovered, someone will need to accompany you home to ensure that you arrive there safely. On the first night after the surgery, as the anaesthetic starts to wear off, you'll experience some discomfort. During this time, you'll take some oral pain relieving medication potentially to make sure that you get good night's sleep and rest. The morning after the surgery requires a check in clinic with me so that I can make sure that your eye is starting to heal correctly and give you instructions about how to look after your eye and use your drops in the post-operative period. At this time, you'll have a patch over your eye, so you won't be able to drive, and someone will need to accompany you to this appointment as well. From the first day onwards, your eye is going to feel uncomfortable and gritty, and as if you can't use it for prolonged periods of time. These symptoms can also prevent good comfort for things such as driving, using computer screens for prolonged periods, and also spending extended periods of time in bright light or outdoors. So you might want to think about ensuring that you've got the ability to take a little bit of time off work and also not have anything too important on that you need to attend during that first week. Some patients will experience mild doubling of their vision for a day or two, or even up to a week after the surgery. And clearly this is also going to impact on your ability to comfortably drive, and for some occupations, head back into work. Over the next couple of weeks, the eye will gradually start to heal and improve significantly in terms of how it feels and how it looks. So by about 3 to 4 weeks, most people are finding that their eye feels and looks pretty much back to normal. And at this time, you should be getting back into doing most of your day-to-day activities and your usual work-related activities. The most important thing at that point is that you don't rush into significantly strenuous exercise or swimming. Once you've had your 4-week eye check, if everything's healing well, you'll be given the go-ahead to return back to these activities.